Hi everyone, and thank you for being here today. I'm Haley with Nexus Youth and Family Services, and this presentation is called Mental Health 101. It's designed to give you the basic tools you need to understand mental health and how to talk about it. With school out for the summer, many families are facing a shift in their daily routines. Kids have less structure, parents might be juggling more at home, and emotions can get heightened. That's why this is a really important time to have this conversation. So what is mental health? Mental health is our emotional, psychological, and social well-being. It influences how we think, how we feel, and how we act. It plays a major role in how we handle stress, relate to others, and make choices. Mental health develops over a lifetime and is influenced by things like biology, life experiences such as trauma, and family history. This means it can look different for everyone. So right now with school out and kids home more, it's easy for mental health challenges to go unnoticed. So that's why staying aware is important. So before we go any further, it's important to clear up some common misunderstandings about what mental health actually is and what it isn't. Mental health is important. It is not a sign of weakness. It is something everyone has, but it is not shameful. It is on a continuum. It is not all in your mind. It is worth making time for, and it's not something to think about only when it feels broken. Mental health is a normal and important part of being human. It's not just the absence of mental illness, it's about how we manage emotions, cope with stress, build relationships, and make decisions. Everyone has mental health, and it exists on a spectrum that can shift over time, especially over periods of change like summer break. There are some common red flags that might signal someone is struggling with their mental health. These include unhealthy eating or sleeping habits, feeling tired or numb, frequent aches or pains, feeling hopeless, or turning to substances like drugs or alcohol more than usual. During summer, it's easier to write these things off as mood swings or boredom, especially in teens, but if these signs continue for more than a couple of weeks, it may be time to check in or reach out for help. So ways to keep your mental health healthy. Having positive mental health means we can operate at our full potential, cope with stress in healthy ways, and maintain meaningful relationships. Some ways to support mental health include getting professional help when needed, staying connected to friends and family, being active, keeping a positive outlook, and getting good sleep. During summer, you can also support your family's mental health by maintaining some basic routines, like regular meals, quiet time, and outdoor breaks. If you're already feeling off, there are some small but powerful steps you can take to improve your mental health. These include getting regular medical care, eating nutritious foods, exercising, setting boundaries, asking for help, and finding times to do things you enjoy. You can also try things like goal setting, exploring new hobbies, or spending time outside. The freedom of summer break is a great time to try out new habits or hobbies that might support your well-being. So awareness is one of our strongest tools. When we understand mental health and how it works, we're better able to spot when something is wrong, and better equipped to respond with compassion instead of judgment. Summer can be a great time to pause and reflect, learn something new, or have those long overdue conversations with your kids, partner, or friends about mental health. Talking about mental health is essential. It opens the door to connection and support, and it lets people know that they're not alone. This is especially important right now. Without school counselors and teachers to check in daily, some children or teens may feel more alone during the summer. Checking in with simple questions like how are you feeling lately or what's been on your mind can make a huge difference. When you go to have a conversation about mental health, there are things you do want to do and there are things you do not want to do. You do want to listen without judgment. You don't want to interrupt or speak over them. You do want to ask, how can I help? But you don't want to tell them how they should feel. You do want to let them know you care, but you don't want to jump in with solutions. You want to empathize with them. You do not want to be critical or blaming. Talking about mental health is very important. It's important to know that suicide is preventable. Talking openly about mental health and suicide doesn't cause any harm. It actually saves lives. Knowing the signs, listening without judgment, and helping someone find support can be life-changing. Especially during less structured times like summer, we need to keep an eye out for those who may be struggling silently. So we all have mental health, just like we all have physical health, and just like with physical health, it's okay to get support when something doesn't feel right. The words we use matter. Avoid using harmful terms like crazy or psycho. Instead, try saying things like struggling, overwhelmed, or dealing with something hard. This helps people feel safe enough to reach out. Sadly, stigma is still very common. It prevents people from asking for help, especially in communities where mental health is not often discussed. One of the best ways we can fight stigma is simply by talking openly and kindly about mental health. During summer, when many feel isolated or unsure where to turn, being a safe person to talk to is very powerful. If you or someone you love is struggling, it's important not to self-diagnose, but reach out to a doctor or mental health professional. They can help rule out physical causes and provide you with the support you need. Therapists help people learn coping skills and talk through what they are experiencing. Sometimes a referral to a psychiatrist for medication may be helpful, but either way, taking the first step is a brave and important move. There are lots of resources available locally and nationally. Whether you're in a moment of crisis or just looking for support, you do not have to do it alone. These numbers are available 24/7 and help is just a call or text away. You can also contact your local county's crisis line for more personalized support. If you found this video helpful or if you've learned anything at all, please scan the QR codes below to participate in our participant demographic survey and our outreach and engagement participant well-being survey. Thank you for watching. Before we wrap up, be sure to check out our YouTube channel where we share videos and tools for youth, families, and anyone looking to better understand mental health. We're here to support you, not just today, but year-round. Thank you for taking the time today to prioritize this topic. It truly makes a difference. Thank you for watching, and don't forget to like, comment, share, and subscribe.